This is Poison, the podcast about an Australian social media influencer who allegedly drugged her 1-year-old child to make her seem ill and then grow her followers and increase her revenue.
And she is riddled with tumours. I think she's having seizures and no one listened to me.
The allegations have been made by the father of the child, and child services have stepped in to remove the children from their care.
I'm Beatrice Yorker, and I'm a professor emerita, so I'm a retired professor of nursing, criminal justice, and criminalistics here at California State University, Los Angeles. And I am trained as a child and adolescent psychiatric nurse. I've worked in big pediatric settings and hospitals, and I also have a law degree. And I have published on covert video surveillance and the Fourth Amendment and the right to privacy and how to set up video surveillance. I've published extensively on Munchausen by proxy and medical child abuse.
Let's start by asking, is it right to be calling it for us Munchausen by proxy, or is there, we have heard that there is another name, factitious?
There are several names. So Munchausen by proxy is named after the Baron von Munchausen, who was a German soldier who told fanciful tale about his war exploits. He was covered in scars that turned out he would brag and say, these are my war injuries. I got stabbed. I got injured in the war. But he fabricated that. He made that up so that he could get attention. And he even went so far as to hurt himself to cause these scars that were part of his lies. Munchausen is when you make yourself sick. So a case that I had is a nurse who passed out at work, and they rushed her down to the emergency room. She was unconscious. They drew her blood. She had very low blood sugar. So they pumped her full of some lactated ringers to get her blood sugar back up, and they told her, eat before you come to work. A month later, she passed out, and her blood sugar was so dangerously low. The doctors in the emergency room were convinced she had a pancreatic tumor. So they rushed off to surgery, removed her pancreas, sent it up to the lab, sewed her up, and said, hopefully we've saved your life. The pancreas came back from the lab perfectly normal, no tumors. But they thought, at least we fixed her. A month later, she passed out at work, rushed down to the emergency room. Only then did the doctors in the emergency room think to themselves, maybe the insulin wasn't coming from her pancreas. Sure enough, the nurse confessed to injecting herself with her patient's insulin to cause her to go into hypoglycemic shock. That is a classic case of Munchausen syndrome. By proxy is when instead of making yourself sick, you make a dependent in your care sick. So most often it is your own child. 95% of the offenders are mothers, but we also have some fathers, some stepmothers, some foster mothers, and a few nurses who inject their patients to cause cardiac arrest and then rush in and perform CPR and be a hero.
Wow. We first learned of you on 60 Minutes, actually. Yes. I was watching on the weekend, and you were on that show talking about one of the most famous, if there can be a most famous case, but one of the more famous cases that happened in the States. Do you want to talk about that one for a moment?
So Gypsy Blanchard is a pretty severe case in terms of the lengths that her mother Dee Dee went to trick doctors. For example, getting rid of medical records and then saying they were lost in the hurricane. So moving a real sort of Munchausen itinerant in order to obfuscate the trail, because sometimes doctors catch on when they go, wait a minute, this person's doctor shopping, and they had all these negative tests. So Gypsy is the only victim that we're aware of who felt so trapped. She had tried running away from home. She got returned. Her mother lied to the police about her age. She had doctors who suspected it. but did nothing to report it to child protection. And she actually believed the only way out was to have her mother killed. So she got the support of an online boyfriend, and they killed her mother for her to escape. And now she's been in many documentaries, because when the police went into the crime scene and found her mother dead, they also found a crime scene of Munchausen by proxy, which is cabinets full of medications. Some prescribed, some not prescribed, some for Dee, some for Gypsy. They found the wheelchair that Gypsy didn't need. They found feeding tube, just a whole crime scene of a mother who is medically abusing their child. And I did want to talk about the terms. So the most widely used still and the most understood is Munchausen by proxy. However, those of us who work in this area prefer to use the broader term, which is medical child abuse. And that is a child who, as a result of lies, fabrications, and exaggerations, is being overly medicated, treated, evaluated, being isolated, being deprived of normal social activities because a parent is subjecting them to excess over-medicalized care and unnecessary medicalized care. Now, the Diagnostic and Statistical Manual of Psychology and Psychiatry, which labels mental disorders, calls them factitious disorder, which is similar to Munchausen. It's where you make yourself sick for medical attention. And factitious disorder imposed on another, which is when you are abusing somebody else. But there are very specific criteria that have to do with the fact that there's no other secondary gain. Malingering is when you make yourself sick or fake that you're sick or that your child's sick for money, for a custody dispute, for benefits from the government because you have a disabled child. So malingering is different, even though it's fake illness. So medical child abuse covers all of that. We don't mind if you're doing it for attention, or if you're doing it to get back at your ex-husband, or if you're doing it to get money, or why you're doing it. If you are lying to doctors and causing unnecessary treatment, medicine, and isolation of your child, that is abuse. We're trying to use that term in the courts. We don't want to get in a fighting war over the diagnosis of the mother. That's like, you don't have to diagnose a sex offender as a pedophile. All you have to do is find evidence that the child has been sexually abused, and you call it sex abuse. And you don't have to go to court and fight over, is this a pedophile or not? We don't want to argue, does the mother have Munchausen by or factitious disorder imposed on another or not? We just want to say the child is over-medicated. The mother has been lying to get this medicine and to get these treatments, and that's abuse.
Is this a mental illness?
The DSM says that factitious disorder is under the form diagnoses. It is not, however, an illness in terms of you're not competent to stand trial. You would not be able to use the insanity defense if you were charged with medical child abuse or factitious disorder imposed on another, because you're very calculated in doing this. You want to make sure nobody's watching you in the hospital room if you inject fecal material into an IV line. You've planned this. And so that is not insanity. However, like substance use disorder, substance abuse disorder, it is classified as a disorder.
You just mentioned fecal matter into an IV tube. There's a case of that.
Oh my gosh. There's probably 100 cases here in the US of that. My first case was in 1984. And what was so stunning when I got my first case, when I was actually working in the hospital and evaluating cases, is that there were 3 or 4 cases already published in the legal literature of mothers who'd been convicted of injecting fecal material into a child's bloodstream in their IV or in their tracheostomy. And then I know my second case. And then when I compared notes with my colleagues who were also writing about this, it turns out that is a common way to get your child hospitalized and treated. And it can kill the child if you don't get the right treatment in the right time.
We keep hearing, or like maybe I keep hearing, that Munchausen's by proxy or just Munchausen itself is not a very common thing. But when I was listening to your interview and like even having conversations with different people, it seems like it's maybe potentially more common than we're aware of. Am I right in saying that? Or do you think people just, does it ever go quite undetected?
Oh my goodness, yes, it goes undetected. So yes, medical child abuse is exceedingly under-recognized and under-diagnosed. We think that there are so many more cases out there. There's educational abuse, mothers who are requesting all these accommodations for their children, getting their children medicine for attention deficit disorder based on their description of the child and them filling out, ticking the boxes on the form for ADHD, for autism. So it can happen in educational settings. It can happen in mental health and psychiatric settings where they'll say my child is exhibiting autistic behaviors and sometimes make the child coach them or make them crazy enough. But no, we see it everywhere. One of the ways that we recognize that it is more prevalent than the literature says is when we started the podcast, Nobody Should Believe Me, about medical child abuse here in the United States. We opened a foundation with a website, munchausensupport.com, and we started getting emails. As the podcast has become more widely accepted or listened to as a true crime podcast and popular, in a period of 8 months last year, we had 825 emails
My goodness.
from young adults or older adults even, but from adults who said, I think I was a victim when I was a child.
Wow.
We have also had about 400 emails from fathers, grandmothers, neighbors, teachers who say, I've got a kid and I think the mom is lying and over-medicating and getting unnecessary surgeries. And as a matter of fact, right now I have 2 dads in Australia who cannot get the doctors to listen, or the judges in a custody dispute, to listen to their point of view that the mothers are deliberately lying about their kids' conditions and over-medicating them.
B, is the reverse true too, I guess, when if this is hard to diagnose, does it sometimes get misdiagnosed?
We have really been looking closely at that. There have been probably 3 cases where a child was removed from their mother or their family for medical child abuse, in which the child actually had a rare disorder that was causing those symptoms, and it wasn't the mother. Okay, we've had 3 of those. But we had lots of mothers who are going online saying if there's not enough evidence, like smoking gun evidence, caught on videotape, caught in a complete lie because the child is separated and the child thrives. And you go, okay, the child does not have vomiting and failure to thrive. We've separated the child is gobbling their bottles, the child is starving. But if there's not a smoking gun, the mother is investigated. These mothers will say they've been falsely accused. But that's not the case. The case is there wasn't enough evidence to remove the child, and that's very different than being falsely accused.
Are there any like common similarities, red flags, anything that I guess you seem to see between each case or perpetrator?
Yes. We have a list in our AFSAT guidelines. One is lying about many things, not just lying about the child's illness, but lying about police reports, lying about your qualifications. We have quite a few Munchausen mothers who say they are nurses or they work in the neonatal intensive care unit. And then we investigate their license and they don't have a license. They're not a nurse. They didn't get their bachelor's degree or any degree in healthcare, but they hold themselves out to everybody as having a healthcare background. So they lie a lot. And there's a fair percentage, not a majority, but a fair percentage who have made themselves ill or lied about their own illness in their past.
As you said that, me and Mickey looked at each other because I'm not sure if I know that we've exchanged a few emails and I've given you a bit of detail on the case that we're investigating over here. What we have been able to prove through our investigations is that she lied about having kidney disease. She actually went online, found a photo of a woman in the US and used that photo. And then we were able to get hold of the woman in the US, and she basically ripped off the photo and the complete caption of this woman's photo in the US and used it for herself.
That's another similarity. That's common. These perpetrators will do that. They'll go find a photo of a rash in a medical textbook or online on WebMD, and then they'll send that photo to their doctor and say, this is my child's rash.
Is it quite easy to almost get away with?
Absolutely.
Yeah, that's
It's
terrible.
way too easy to get away with. Doctors are trained to formulate a diagnosis based on the history, what the patient or what the patient's parent tells them. That's how they start clicking their brains as to what could this be? Do you have fever? Are you shaking? Do you have seizures? Do you have this? So much of medicine is practiced based on what people tell the doctor.
It feels really narcissistic. Is that a fair?
Yes. So the research into perpetrators shows that the majority of them have a cluster B personality disorder, which is narcissistic, histrionic, which is like hysterical, antisocial, which is like a psychopath, and borderline, which is difficulty in relationships and trust. And there's a huge overlap between the narcissistic and the antisocial or the psychopathic tendencies for people with this.
Has social media exacerbated this in your mind?
Yes. I wrote an article on the influence of the internet on medical child abuse. And so back in the 80s, when I was first doing this work, perpetrators would have to go to the medical library and start checking out books. But since the internet now, they just go to WebMD, they can take photos of a rash, send it to the doctor, say, this is my kid's rash. So it makes a lot of it easier. There are also ways to infiltrate rare diseases where you learn a lot about rare diseases and you learn, oh, there's not really a test for this disease. So maybe this is the disease that I tell the doctor that my child has all these symptoms of because there's not really any test. So in that way, it has enabled perpetrators. But at the same time, a lot of the perpetrators GoFundMe, crowdsourcing for fundraising, and they'll post these things saying my child is dying. And then a nurse will go, wait a minute, I know that child. The child is not terminally ill. The child came in for a routine evaluation and we packed him home. And here's the mom on social media saying that the child is dying. So sometimes it can be used as evidence of lies.
One thing I actually was almost like overthinking before we did this interview, and I was listening to your 60 Minutes interview, and I was like, I can imagine people, say someone who has Munchausen's or has, I don't know, the potential, listening to this, listening to other cases, almost, I don't want to say inspired, but do you know what I mean?
So we actually don't think that we are causing people to do this if they did not already have the propensity.
Yeah. Okay.
What we might be doing is giving ways to go deeper underground and hide, or giving them ideas of how to do more abuse. Okay, like I've already talked about, injecting fecal material into an IV. Somebody who wanted to get medical attention and wanted to lie or cause an illness might be listening to this and go, oh, I hadn't thought of that one. Or injecting insulin, or giving too much seizure medication to cause the child to look like they're passing out. What I have found is that the people who do this will figure out some very devious way, and that most of the mothers, especially in the 80s, when we were just finding out about this, had never talked to anybody else or didn't even know. The idea of injecting feces into an IV seems to come from within. It's a mind that thinks that way. And that's where we are with the Munchausen by proxy. It is a thing. It is a compulsive need to be in a medical arena, to have sickness, and to the point of death, because Munchausen syndrome and by proxy have a 10 to 12% mortality rate. People kill themselves with it. People kill their children with it.
Before we saw you on 60 Minutes, we'd had, I would say, at least 30 emails
Yeah.
from people who've listened to the podcast saying, you've really got to have a listen to this show in the States and get the host on, or one of the hosts on, which is called Nobody Should Believe Me. And you are on that podcast. You've contributed to that podcast. Tell me about that show and what sort of topics do you discuss? Obviously, you're discussing what we're discussing here, but how deep do you go?
Andrea Dunlop is truly a hero because she has taken on the deep dives to get all of the records. She's taken on how many false allegations are there, how many innocent mothers may have been wrongly accused of this just because they're anxious or just because they really are afraid that their child is being sexually abused and they can't get it out of their minds. So even when somebody reassures them, they keep doing it. So she does deep dive. She looks at the actual records. But Andrea started the podcast from her own family's experience when her sister was separated from her niece and nephew for concerns of medical child abuse. And it tore her family apart, and it's been very difficult for her. And she started reaching out to the American Professional Society on the Abuse of Children, APSAC, because we have a Munchausen by proxy task force and committee that has been publishing guidelines and doing this work. And so she reached out to us, and she has been now finding really good stories to do deep dives on to explain this. And she looks at some overlapping things as well. For example, you all have had Belle Gibson in Australia, and Belle faked her own cancer. And then when interviewed on 60 Minutes, when they said, Belle, did you fake your cancer? She said, I hope not. I think a doctor misdiagnosed me. And so it's the same sort of squirrely behavior that we get when we interview perpetrators who are trying to just come up with the next explanation or fabrication.
One thing that I'm really interested about is like, how do you begin to maybe question that you might know somebody who has Munchausen or is medically abusing their child? Because it is such a difficult thing. Even this case that we are discussing and that we've been researching, I was watching it from afar going, I just feel like something's off. Do you think it becomes quite undetected because people around them are too afraid to or unsure how to be the person that goes, I don't think that this is real? Because it's a really hard thing to step in and start questioning, like, do you actually have cancer?
Yes, it's very hard for the lay person, the friends, the family, the people who have suspicions. It's very hard, especially when, and I hear this so much from non-offending fathers. So right now we have about 60 fathers who are in small support groups who are sharing their terrifying experiences of, first of all, giving their ex-wives huge benefit of the doubt. Okay, first of all, they'll have a suspicion and then they'll go, oh no. And then they'll confront their wife and their wife will completely reassure them. Oh no, everybody's mistaken. It may look like that, but no, this is really real. Our kid is sick. At some point, they can see the damage that's being done. Say maybe they get divorced and they have a kid for the weekend and the kid is fine. No vomiting, no food allergies, nothing. And then the kid goes back to mom and all of a sudden starving, food allergies, doctor's visits, ear tubes, all the medicalization. So that's when they start going, wait a minute. When the kid is with me, they're okay. Now, there's a way for professionals to be clearer as to whether or not they should report it, and that is do a medical record review. So what we like to do is we like to look at the mother brings the child into an urgent care, and she says the child's been vomiting for 3 days. And they say, okay, just give them plenty of liquids. The child does not look dehydrated. 4 hours later, mom goes to a different doctor or pediatrician. The child's been vomiting for 3 days. And they say, okay, we'll admit the child. And then they say, we need to see the child vomit. And you can see that there's actually no record of the child vomiting. It's all just what the mother says. So we tried to go through the records. The mother may say the baby was a preemie. Get those birth records. If the baby was born 8 pounds, then okay, the baby wasn't a preemie. The baby was okay, but the mom is already telling people the baby was a preemie, and that's why the baby's so scrawny and tiny and has all these issues. So a record review helps you see if there are contradictions between what the mother says and what the tests find and what the objective findings are.
How much do you know about the Australian case that we're discussing?
Only from the news articles.
Reading through those articles, what were your thoughts as you looked through them?
Classic. Absolutely classic. If you listen to Derek Jones, and we have another dad, I think George Honeycutt, both of those dads got a call from the hospital that said, your child is testing positive for Benadryl, benzodiazepines, all these medicines that should not be in the child's system, and it's at toxic levels, and that's what's causing your child to look like they're having seizures. And another thing that's very similar is the fundraising. The whole family saying, oh, we can't pay these medical bills, help us, our poor kid, and posting what Dr. Feldman calls medical porn. Some of the photos posted by the mother on social media are exactly what we call medical porn. What child wants to have their photo to fundraise with their electrodes on their head and their tube down their nose and a bandage around their head and their body in a hospital gown in a hospital with IVs and tubes running in them. That's medical porn. And so that's another huge similarity.
I think the way that you described that, I looked at Jay and I was just like, that's the perfect
Explanation
for what it is. You spoke before about how I guess social media and the internet might be exacerbating cases. Medical abuse is an attention-seeking thing.
Yes, for the most part. It is attention-seeking, or it's money-seeking, or it's aggravate the baby's father because you're in a high conflict custody dispute and you want to be the heroic mom and the dad can't possibly provide all this medical care. And so you want to keep the child from the dad, or they lie about false allegations of sex abuse from the dad because they're at war. It's a scorched earth with some of these mothers once people start confronting them.
Yes, so like the attention side of it especially, I feel like if someone is really trying to gain that, social media would just be such
It's a gift.
oh yeah, that
It
would
is.
just
So Mark Feldman noticed with the internet and with online support groups that he even called it Munchausen by internet. It's too easy when you can have a pseudonym. And if you're not even on Zoom, if you're just typing away and you're telling your sob story, it's too easy to be able to create a persona who's dying with cancer. And so, yes, the internet is a breeding ground for people who want that kind of attention.
Is there a, I don't know if this is the right word, but is there a cure for someone with?
It's very similar to other disorders that are high shame, high denial, like pedophilia, like substance abuse. Okay? Most of those things cannot be cured. But what we can do is engage in a 12-step program or a process of getting into recovery. So we have the accepts model, which if a mother has been legally separated from their child because of Munchausen and medical abuse behaviors, the only way that the courts now will let them reunify is if they follow ACCEPTS. First is acknowledge. Admit that you did what you did. Talk about it fully. The mothers that I have worked with have only admitted to what was caught on video or what was absolutely the smoking gun evidence, the presence of E. coli in the bloodstream, the toxicology screen that showed toxic amounts of benzodiazepines or seizure meds. Okay, most of them only admit to exactly what we found. So what we expect is they'll admit to all of it, and that then they will take responsibility and apologize, not only for having harmed their child, but for having their family torn apart by the child being put in protective custody or the investigation and so on. So it's really working the steps of apologizing, owning, and finding better ways of coping with stress. These behaviors do seem sometimes to wax and wane, depending on the circumstances of the perpetrator's life. And they need to basically get into recovery so that they are in a stable environment where the triggers that make them want to get this attention and want to lie about their child, that they're avoiding those triggers. So it's a recovery process. We have very few cases of mothers who have actively induced, either smothered their child, injected their child, poisoned their child. We have very few cases of mothers who've done that work and truly worked the steps to get into recovery so that they are safe with children again.
I feel like it would be so hard to ever fully trust. That's my first thought, is like them being back with children, and my heart just goes, that sounds scary.
Terrifying.
It is very scary. We had a case in Texas where the mother was arrested, put in jail. The kid almost died because she'd given the kid so much Benadryl and other drugs. And so the mother was arrested. She was in jail. She was out on probation. Okay. She was out of jail on bail. She found another man with a child on the internet on a dating site and started giving his child pills. And then she did it again. She violated probation twice by finding men who had children and giving them pills. She got sentenced to 60 years.
Thank
She
God.
could not stop herself. Even when she knew eyes were watching her, she could not stop herself.
See, that was my next question, because I know you would, in the 60 Minutes interview, you spoke about the case where a mother was injecting her baby with feces and the baby had E. coli and got very sick, I think almost died. And there was like video evidence, everything. And I think you said that she ended up getting 2 years.
Yeah.
And that to me
That's
was
classic.
quite shocking.
That's classic. And when I say to judges, if I'm ever called to testify, is I say, if this had been a father who had beaten his child to within an inch of their life, we would not be looking at 2 years. And yet this mother just about killed her little 18-month-old son. And you're going, oh, she's a sick woman. She shouldn't be in jail. She should be in therapy. And I'm like, oh, this is gender bias.